institutions and our financial reimbursement systems are founded on outdated ideas of separate diseases and medical specialties. Abandoning these ideas threatens their economic viability and perhaps even their existence. And our medical training reinforces the illusion of separate body systems by training doctors in specialties and subspecialties. There are doctors for every inch of your body, but very few who understand the whole body and how it works as one complete ecosystem.
Medicine, from my perspective, because of some of the changes with HMOs and the whole insurance industry, has gone to more of an algorithmic approach to taking care of people. Now, when I say that, what exactly do I mean? You come in with a problem with depression, and so I say, okay, here, try this antidepressant. It doesn't work, so what do? Well, here's the next antidepressant on the list. If that doesn't work, well, let's try the third or the fourth or the fifth, or maybe after the fourth time it's not working, maybe we switch to a mood stabilizer or something else. So there's not so much a lot of thinking about what's going on and what's causing this person to feel or think the way they are. It's more, if something doesn't help, then try the next, medication on the list. In contrast, the functional approach really asks more deeper, probing, and from my perspective, thinking questions, which most doctors have spent a lot of time learning, and we might as well get the best out of their brains to help people get better.
What has happened is that we are practicing medicine that's a century out of date, basically. While things have moved forward in Silicon Valley and things have moved forward with iPhones, and look at what you can do today that you couldn't do even 10 or 15 years ago. Medicine is still being practiced an old-fashioned way where we look for a specific diagnosis. We ask what? What is it? Is it measles? Is it a broken bone? Is it rheumatic fever? What is it? And then for each thing, what it is, we get the right prescription, we give them the right thing to do it. That's not the way physiology works. So what we need to do then is to ask in 21st century medicine, instead of to ask what it is, to ask why it is. What are all the contributors? And so we need to close what I call the complexity gap. So for example, you have a computer that can fly a plane, for example. You have to match the program with with what is required for the plane, with the complexity of what it takes. Now in medicine, we have a tremendous gap. We have human organisms that are incredibly complex. They have complex chronic illnesses like neurodegeneration. And what do we ask? Serum sodium, serum potassium, a few things like this. It doesn't come close to addressing it. Therefore, what do we come away with? The idea that these diseases that are complex chronic illnesses are ineluctable, that you can't stop them, you can't see them coming, there's nothing you can do. What that is wrong. If you use larger data sets, if you look further at what is actually driving the problem, and we can see this from the laboratory research, here are the things that actually drive the problem, then you can see that in fact there are specific contributors, and it's virtually never one. It's a combination of contributors that add up to an overall change that leads to a complex chronic illness, like one we would call Alzheimer's disease.
How do we find the cause of this epidemic? Are we as humans defectively designed? Or is it our toxic environment, our nutrient-depleted diet, and unremitting stress affecting our sensitive brains? Is it the result of imbalances in our body? Are more drugs really the answer? Or is there a way to address the underlying causes of this epidemic so that we can regain our mental health and live whole, functional, fulfilling lives?
So functional medicine is not a sexy term, but I like to tell patients that it's really about creating health as opposed to treating disease. Because when patients come to doctors, they come in usually with some kind of symptom. I have pain, I'm tired, I'm overweight, I can't remember, whatever. And then you're sort of, say, here, take this pill, try this, see if it works, without asking the question, well, what kinds of things are you doing, or what kind of things are you not doing that's causing you to go down this path of ill health. Because our bodies are really incredibly designed to have resiliency, and we also have health built into it.
There was a lot of time in medical school and right after medical school where I was really questioning my decision. I was doing a lot of acute care medicine, and we weren't really focusing on nutrition and prevention. And I was frustrated. I was absolutely frustrated with medicine and questioning significantly what I got myself into. So when I found functional medicine, it was great because I could say, okay, I can do this type of medicine. I really appreciate this type of medicine. I see how this type of medicine works. And it was that great map so I could continue to practice medicine in a way that I felt fulfilled.
I like to say to my patients when they ask what is functional medicine, I tell them, and I do what the Lipitor commercial says to do. And that is, after a trial of diet and lifestyle, consider Lipitor. Well, if you do the diet and lifestyle right, you rarely need the Lipitor. Functional medicine is asking a fundamentally different question. In conventional medicine, we're asking what? What's the diagnosis? So once you have the diagnosis, there is sort of a prescribed set of treatments based on algorithms. In functional medicine, we're asking why. So an individual might have heart disease. And okay, so how do you treat heart disease conventionally? Well, you might use some kind of cholesterol-lowering medicine. You might send them to a cath lab and they get a stent or whatever. But in functional medicine, the question is, why do you have heart disease and someone else doesn't? We know that more than half of people with heart disease have normal cholesterol, so clearly it's not just cholesterol. So asking these why questions gets underneath the symptoms and underneath the conventional diagnosis to more personalized medicine. One person with heart disease might have a problem with the way they process folic acid, and they have a high homocysteine that causes a problem. Another person might have high inflammatory markers and so on. And interestingly enough, if you have 4 people with heart disease, they might all 4 have different underlying whys, whereas 4 people with 4 different diagnoses might have the same underlying why. So it becomes less about the diagnosis and much more about the individual's relationship with their environment. By environment, I mean their diet, their lifestyle, their thoughts, their beliefs, their community, their purpose, their sense of belonging. All of those things impact our health.
Now, medical thinking is what I call name it, blame it, tame it, prescription pad medicine. Patient comes in and says, I have this for a couple of years now. Oh, you have such and such. That disease is the cause of your problem. Right away, that's stupid because the diseases don't cause the problem. The problem simply needs a name. But the problem is the details. So you blame the name for the problem. Like your problem, like you come in and you say you feel sad. So, well, you have depression. Depression is the cause. Now we have a pill that is for your depression. So you tame it with a prescription. So we call it name it, blame it, tame it, prescription pad medicine. That's my snide way of describing the medicine that I was trained to do back at Yale in the 1960s. Whereas the functional medicine that I practice now is we call principle-based medicine. It's based on a few fundamental principles, really quite simple. And they are that everybody's an individual. That's so important, that every living thing on the planet is an individual. I mean, that's the way it was created.
So we have a very different way of thinking in functional medicine, which is actually looking at how the body affects the brain. And that is really a fundamental insight that I had once I started treating patients for their physical problems. Their mental problems got better, their ADD went away, their autism improved, their depression went away, their anxiety went away, their panic attacks went away. And I thought, wow, this is something that nobody's talking about, how our body affects our brain. And the first thing to do when you have mental illness, when you have ADD, when you have depression, dementia, any of these things, is to start to treat the foundation. There may be psychological issues, there may be trauma and stress, but those things are much easier to deal with once you build the foundation of health. So the fundamental problem with conventional medicine is that we describe disease by symptoms and not causes.
Food is one of the most important interventions, but whenever we think of people here at Amen Clinics, we always think of people in 4 circles. So we look at their biology. So that's where diet comes in. It's also where the scans come in, and also where have you had a head injury, that comes in there. We look at their psychology, how they think. We look at their social circle, who do you hang with? Because people are contagious. You become like the people you spend time with. And there's a spiritual circle, which is why are you on the planet? What is your deepest sense of meaning and purpose? So whenever we intervene with someone, we have biological interventions, food, exercise, nutrients. Psychological interventions, learn to not believe every stupid thing you think. Thoughts lie, they lie a lot. They're social interventions. Who do you hang out with? Let's assess that. And there's spiritual interventions. Why do you care? And when we use those 4 circles, people get better.
There's this radical new field. It's been around in the scientific communities for a long time called epigenetics. And that just speaks to our ability to take control of our health. And that applies to the brain as well. And we can do things like change our diet. We can change the way we think about things, our mindset. We can make changes in lifestyle. We can exercise more. We can connect more with our loved ones. All those things have been proven to actually slow, stop, and even reverse any type of neurodegeneration. Things that are good for the heart are also good for the brain, right? Things such as exercise and diet, lifestyle, specific supplements, stress management.